Hello and welcome to a McKnight's one-on-one interview that will really hit home for virtually every long-term care operator in the United States. I'm McKnight's Long-Term Care News Executive Editor Jim Berkland, and today we're speaking with Dr. Jeff Andrews, Medical Director of Molecular Diagnostics for BD Life Sciences. Our topic centers on coping with COVID-19 conditions and more directly, getting the most out of point-of-care testing units that can make such a big difference for long-term care operators. One of those, of course, is the BD Veritor-Plus, a rapid point-of-care antigen test now in more than 11,000 nursing homes around the country. BD, of course, is the well-known global medical technology company. It's advancing the world of health by improving medical discovery, diagnostics, and delivery of care every day. This, in fact, is the first in the series, Right Time, Right Results, Passing the COVID-19 Test. It will feature interviews for, about, and with providers and how they can make the most of these valuable tools and deliver better care. So first of all, Dr. Andrews, welcome.
Thank you, Jim. It's great to be here, and I'm happy to talk with you about nursing homes and long-term care facilities and assisted living with respect to COVID-19.
Well, COVID-19 has definitely been the topic of the year. 2020 has been a year of many unprecedented changes with the onset of the pandemic. How is BD currently working to help providers respond to pandemic conditions?
Well, Jim, first of all, BD's not just a company. It's made up of all of the associates that work at BD globally. And I can remember back in February talking to associates in China and a few weeks later in Italy. And that was before we knew that the pandemic was coming here. BD began responding rapidly and increased our ability to supply the needs of providers globally with millions of products, including swabs, the molecular diagnostic tests or PCR tests that run on our BD Max system, and of course the 15-minute rapid point of care test you just mentioned, the BD Veritor-Plus, is our latest advance to address these needs. We also supply infusion pumps, infusion sets, IV catheters, and other products that are needed in the hospitals and within the healthcare system. We've made commitments to both federal and state governments to supply increased testing, especially with the BD Veritor-Plus. Part of that involves a partnership with the HHS to deliver more than 11,000 of the analyzers and 3.75 million SARS-CoV-2 antigen Veritor tests to support rapid testing at more than 11,000 nursing homes across the US. We've been scaling up our global manufacturing steadily over the last few months. So we're currently delivering more than 8 million of those rapid Veritor tests every month globally, and we'll be up to more than 12 million tests per month by March of 2021.
Those are numbers quite impressive. Now, can you tell us a little bit more about the BD Veritor-Plus system and what makes it effective?
Yes, Jim. So first, it starts with a swab. In our case, for the case of the BD Veritor test, the swab is a nasal swab at the entrance to the nose. The specimen is then on that swab, and it's mixed with what's called an extraction agent or a fluid, and then drops of that are placed on a strip within a cassette. And then you wait 15 minutes for that to mature, and then put the cassette into the analyzer, and it reads the result of the test. So the way the test works, the antigen refers to the protein that the virus has. The nucleocapsid protein that surrounds the virus is the target of the test. The way the test is read is by monoclonal antibodies that are in the strip, waiting to see if the protein comes along. They will bind to it, and that will cause a transformation that can be read by the analyzer. So if the antigen test is positive, it means it identified that protein. It's a rapid test, 15 minutes, and a point of care test because the testing system can be moved around from place to place. It's quite small. It's a little bigger than a large mobile phone. So that's effectively how it works by being a rapid test deployed at the point of care, giving you the result very quickly. And that's important because it allows you to identify people who are positive so that they can be isolated from everyone else and stop the transmission of the virus.
No doubt, very key to the listeners tuning in today. Now, we've heard that the Department of Health and Human Services has provided BD Veritor-Plus system, as you said, to more than 11,000 nursing homes across the country. How has that rollout gone?
I think it's gone great. We did all the deliveries that Admiral Giroir asked us to, and then we provided the training and support. And now it's transitioned from that initial rollout to reordering and restocking of tests as it carries on. You know, that took place at a time when the trend in new cases in the United States was going down. If you think back a couple of months, so we were all hopeful that we were going to get this more under control. But then we've seen in the last several weeks that it's turned back up again. So it's even more important now to have adequate testing at our nursing home facilities where the most vulnerable of our population live.
It is unfortunate how we have that upswing, and it's just all the more important then, obviously, that we have these systems in place. Now, the key is, how is BD helping nursing home operators learn how to use the device properly?
There's a whole number of ways. So, I mean, the simplest thing is there's some instructions inside every kit, but much more than that, we have an online training program with a series of videos and word material. We also support people live when they're first getting going. We have a call center, which can be a live chat, or you can request a call back. We've created a series of webinars, and there's 5 of them right now, which are available for viewing at any time. They were originally live, of course, and we're always adding more. We have a series of 10 different videos on YouTube demonstrating all aspects of using the BD Veritor test kits. And then on the website, which is a dedicated website, bdveritor.com, where you can find all of the training aspects that I'm describing. There's also, of course, the detailed evidence from the clinical studies we've done, as well as helpful infographics that explain the different test results. So we have a complete portfolio of training that we offer at the beginning and all the way along for any nursing home. And we're also available to support the nursing home if they have.
Of that all, do you think, or do you like most when you're talking about the videos and the website and everything? I know it all must be helpful.
Well, my favorite thing, Jim, is probably the FAQs, the frequently asked questions, because I love answering questions. So I've really liked participating in our development of those. We get new questions every day, and we know that it's not going to be the only person who has that question. So we develop a brief answer and feed that back so that all of the users can see the frequently asked questions and answers. And it's fun to answer questions that you never thought of before, but they keep coming in.
Excellent, excellent. Now, when you talk about training individuals in the nursing home setting, who can be trained? Who's this training for?
Well, that's a good question, Jim. And at the moment, the recommendations from the CDC and from CLIA that provides the certificate of waiver for the lab where this testing is occurring requires that the person be adequately trained to use the instrument, and we're providing that training. So these nursing homes have a supervising clinician, if you will, and they determine the necessary capabilities of a person who's doing the testing. It doesn't have to be someone with a healthcare worker certificate necessarily. It just has to be someone who's interested, able to pay attention to detail, and very concerned about the importance of accuracy, because it's very important to follow the instructions accurately.
Regarding staffing on that, you described that certain people don't have to have extraordinary qualifications, but what if a provider is saying, well, where do I find these people, or who can do this? What would your reply be to that?
I think that most of the people who are already at the nursing home could be asked if they'd like to participate in the program, be trained to do it. It's one of those things you probably want to rotate a few people around so they're not always doing the same thing every day. But typically the nursing home would have many people who would be qualified to do this testing.
Okay, outstanding. Now, we know that HHS also requires nursing homes to report the testing data, to help understand and trace disease transmission. What technology is available to help providers streamline reporting of results?
You're right, Jim, that is an important requirement. What BD offers is the BD Synapsys Informatics. So that's an integrated solution that connects to the BD Veritor analyzer, and it takes the data and is able to generate reports in compliance with the CARES Act, which is what you're referring to. The CARES Act requires any of these facilities doing testing to report their testing data locally and often to the federal health authorities on a daily basis, including the number of tests that have been done, positives and negatives, and key patient demographics. So by streamlining this data that's coming out of the analyzer, we can really reduce the burden associated with this reporting, which would otherwise need to be manual. And it's important because there's potentially a fine if you get behind in reporting. So we're helping customers avoid any of those potential problems. And so timely and accurate reporting also supports the public health initiatives in that local community to respond to and monitor the spread of COVID, including local outbreaks.
Now, to follow up on it, I was going to say, there hasn't always been daily reporting to the federal sources and federal authorities. How important is that in the grand scheme of things?
I think it's very important. I track a lot of these dashboards, and if I get a call and someone's in a particular county, you can usually look up the dashboard for that county and for the state. You can see what's happening with the case rate, with the test positivity. And as we've seen this week and last week, these things can change rapidly. And especially when you're looking at the whole United States, there's a red area or a hot area one day, and then the next day it pops up in another state. So these reports are critical for understanding what's happening with the pandemic.
Now, the Veritor systems, they're everywhere. I mean, they're not just concentrated in certain areas, correct?
That's correct.
Okay, good.
All over the United States, we have more than 11,000 units in nursing homes, assisted living, and long-term care facilities. But of course, there are Veritors outside of the nursing home infrastructure in many other settings across the United States.
Okay. Now, there have been some concerns voiced around false positive results and their potential impact. Can you explain and what causes false positives?
Okay. Well, maybe we'll step back. Of course, if there's such a thing as a false positive, there must be a true positive. So in fact, there's four categories of result: a true positive, a false positive, a true negative, and a false negative. So what this refers to is if the antigen test, in this case the Veritor, gives a positive result, and the reference test, which would be a PCR, is also positive, then that's a true positive. We are very focused on the importance and value of true positives, because that's the purpose of this testing, is to identify the people who are positive so that they can immediately be isolated to protect others. But sometimes when the antigen test is positive, the PCR will be negative, and that's called a false positive. And maybe later we can talk about the negatives, but I'll I'll focus on the false positives. So every test has false positives. In the realm of COVID, even the PCR test can have false positives. This particular test has very low false positive rate, somewhere around 0.5% or less. So it only becomes important when there's low prevalence. Low prevalence means that when you're doing many, many tests, you're only finding a few positive people, which is good with this pandemic if you've only got 1 in 1,000 people who are positive. But in that type of setting, some of the positives that you pick up will be false positive. And so in a low prevalence setting, you may want to retest the few positive results in order to differentiate true positive from false positive. But when you're dealing with a higher prevalence, like an outbreak or symptomatic people, the issue of false positive is relatively unimportant because it's so small compared to all the true positives that you're identifying and responding to. How am I doing? Did I answer your question about?
I think it's fantastic. I think you can go into even more detail because people are going to see the phrase false positive, be it in a headline, a newscast, or whatever. And from what I'm hearing from you, I think may be important to get across is that false positives are almost expected to some degree all the time. Is that correct?
That's correct. They are. And when a nursing home reports a false positive, we respond immediately and talk to them. And if they're having a high number of false positives, we will investigate in great detail, most likely go to the site and do things like that. But in all of the more than 11,000 nursing homes, I think there's 12 nursing homes that have reported a higher than expected number of false positives. So less than 1 in 1,000 experience that problem. We think that some of the reasons for that might be not strictly following the instructions for use, some type of error made in the handling of the samples, maybe waiting too long or not waiting long enough before putting the cassette in the reader, and then interfering substances in the samples. And I'll just note with you that the HHS Assistant Secretary for Health, Admiral Giroir, and the Deputy Director of the FDA, Dr. Tim Stenzel, have both said publicly several times that false positives are just part of testing, and that the false positives reported by the antigen test that the HHS is rolling out are within the expectations, and that it's important to keep using the test because of the identification of true positives.
Okay. And it could be one of those cases where people say, don't let the perfect be the enemy of the good. Or
exactly. Or don't throw the baby out with the bathwater.
Okay, there you go. Okay, now you opened the door as well. I'd love for you to come back to the idea of false negatives, because for a while that was also very much a topic du jour. Would you care to comment a little bit on that?
So that becomes an important consideration when we're talking about someone who's symptomatic. So if you think about a symptomatic patient, what are their symptoms? Their symptoms are usually something to do with pneumonia. And so that could be COVID, it could be influenza, it could be bacterial. They might have other types of symptoms that are making them concerned, maybe just a fever and aches and pains without any pneumonia. So it's possible that the test could be negative, so you have to expect some negatives. But when the presentation of the patient gives you a fairly high concern that this could be COVID-19, if the initial antigen test is negative, the FDA and CDC recommend that you follow that negative antigen test with a PCR test. So in symptomatic patients, particularly in a hospital outpatient setting, an initial negative result might be followed up with a PCR, especially if there's a high clinical suspicion of COVID. That's okay, because when the antigen test is positive in a symptomatic patient, again, you're quickly arriving at a diagnosis and you're able to initiate some of those therapies that we've heard about. If the if the test is negative and you're worried about it, that patient is typically quarantined pending the result of the PCR test. So this is all just part of a CDC guidance on how to respond to these different test results. And as you said, both false positives and false negatives are part of diagnostics. And the important thing is that we know what to do about them. There's guidance around it coming from the CDC. And most of the states have adopted the CDC guidelines. So this is now very consistent across the United States.
Okay. Now, a few minutes ago, you mentioned a few things that might trigger a false result. I don't know if we'd call some of them operator error or whatever like that. What have you found with the rollout that have been easily correctable, or things that maybe you're saying, okay, here's all you have to do, Mr. Operator, Mr. Provider, to tweak your process? What are you finding on the facility level that is easily fixed, that sets things right?
Well, Jim, one of our protocols is to retrieve the analyzer and then investigate it back at the lab. And in every case, we found no problem with the functioning of the analyzer. So that kind of redirects our attention to the issue of carefully following the instructions for use. And so in every case, we've reinforced our training, and we feel like that's the corrective measure, because that appears to take care of the situation. And then you have to remember that in the vast majority of cases, the Veritor-Plus system is working well with no issues with high false positive rates.
Absolutely. And if I look at my notes, you said something to the effect of 10 videos and 5 series. And can you review some of those? I mean, you have great resources there for somebody who wants to read up and to look back and see how they're operating these things. That's right, isn't it?
It is. You probably use YouTube when you're trying to fix something around the house. And so we've got 10 videos there showing all the different steps. We've done 5 fairly lengthy webinars, and they're all stored at the bdveritor.com website. There's a lot of written materials also at the website. Of course, there are paper instructions for use in every kit. We do training at the time that the product is launched on the site, and then we have a call center where you can speak to someone right away, or put in a request for a callback at a certain time. No shortage of resources for training.
You know, and when you put it that way, I have to smile because of some of the appliances and tools I've bought around the house. It is exactly what I want to do, is to go see how it works. And it's fantastic that this is available, and this is how it will go. So we've talked a lot about COVID and the upswing and some of the trying times we have. What point of optimism can you give the listeners to look at as we go forward? Because certainly, as you talk about some of these things, a lot has come into being since the pandemic has started, and I think some of that gets lost track of. So what would you say to give people a little bit of optimism looking forward?
Okay, that's a great question, Jim. And I think we're all aware on this day in the middle of November that we now have 2 promising vaccines. We haven't seen the data yet. And we also know that the administration and the states plan to prioritize healthcare workers and then nursing home facilities. So the people that you and I are talking with right now who work at or live in a nursing home should be in the first wave of vaccination. So that's going to give a high level of protection. We'll still need social distancing and masks and everything else. That's going to be helpful. The other thing is that the incoming administration has already placed a high priority on diagnostic testing, which was not so much true previously. So I think we're going to see more calls from leaders about needing more testing. We should see an expansion in the contact tracing and testing, which is also very important for stopping the spread of COVID. And so we at BD continue to increase our production ability to support what we see as an increasing need for BD Veritor antigen tests and our other molecular tests in the United States in order to help, because in addition to the public health measures like mask wearing and social distancing, we need testing. It's very important to help stop the spread. And then when the vaccine comes along, that's going to make a big difference, but there's several months between now and when we're going to see a decrease in the case rate from the vaccine. And during that time, testing continues to be very, very important, especially rapid point of care testing like the BD Veritor.
This has been an excellent kickoff to the start of this BD series. Right time, right results. Passing the COVID-19 test. Next, we'll be talking with some providers to learn how testing is going on in actual nursing home settings. Success with them is right around the corner. We look forward to seeing you then. For McKnight's, this is Jim Berkland. Thanks again for tuning in.